Hello friends, myself Dr. Vaishali Sharkar. I'm a consultant ENT surgeon practicing in Kolkata. Today I'm here to give you information about noise induced hearing loss. Many patient comes to me telling that whether if we get exposed to noise, is it harmful to our ear, how much noise you have to get exposed, when it can damage. Okay, so let me tell you what is the structure of the ear. Basically, ear has an external component, middle component, and an inner ear component. So when you expose yourself to a very loud sound suddenly, okay, then you can have a issue like the eardrum may get suddenly burst, okay, and perforate. You may face in addition hearing loss, bleeding from the ear. Apart from that, there are small three bones inside the ear. They may also get little bit dislocated in very high sound. And some people come to us that I have exposed to very loud sound and suddenly now I am having no hearing from that ear. That is sudden sensory neural hearing loss. It is very high intense hearing loss happens. Okay, it can happen to elderly, it can happen to very young age people. So what we do, we always treat the patient within the first 72 hours. We need to install medicine within the first 72 hours because that is a crucial time and that regress the patient to normalcy when as early as treatment is started. Now next question is, now it is not a sudden exposure. You are exposed to repeated sound for long duration of time. Maybe you are working in an IT sector, maybe you are working in somewhere where there is constant sound exposure. Then it is very important for you to know that if the sound exposure is for long duration of time, maybe you are having for 8 hours, 12 hours, you have to use a earphone, you have to keep in mind that give a pause. Like you use the earphone for a continuous 1 hour, give 10 minutes gap. If you use for a continuous like 2 hours, give 1 hour gap. Means give a gap so that the ear get time to acclimatize and get normalized. The inner ear, the nerve doesn't get sensitized and doesn't get in a phase of damage. Okay, so that is one way. If somebody is in a place where there is lot of sound and every day you need to expose, there is a easy way. You can use earplug. Earplugs are available nowadays that if you put in the ear, that will prevent the means the high volume of sound to come in the ear, and in that way you can safeguard your ear. So this is all about noise induced hearing loss, which is very important for you to know. Nutshell of the topic is the importance of first 72 hours. When you are having a sudden hearing loss, if you come within the first 72 hours, then maybe your hearing will regress to absolute normal level. Okay, even if you have a 95 decibel hearing loss. Apart from that, one more thing, if you are getting exposed to high volume sound and that has caused some damage to the eardrum, you do not put eardrop without going to doctor. Just putting a eardrop and seeing how things can improve, don't do that, because if there is perforation of eardrum and still if you put some eardrop, the perforation closure will not happen automatically. Then some other measures you have to take. Thank you friend. Will come with some other video next time. Thank you.